Hello, everyone. Thank you for joining us this Friday for this webinar on intersectoral engagement in health emergency management for older adults with complex care needs in the community, from research to practice. My name is Laura Katawaki, and I'm a research and knowledge mobilization specialist with United Way BC. And I'm very happy today to be able to host this webinar, which is actually going to be an opportunity to share some research that Fraser Health has been working on and that United Way BC has been a community partner on. And I think this research is going to be very timely, of course, because it does focus on health emergency management, and particularly within the context of climate emergencies, which I'm sure as we're moving towards the summer, everyone is thinking about how we can better cope with climate emergencies. And so we're going to be able to hear from the findings from some case studies reflecting back on the BC heat dome, as well as the flooding that occurred in the Fraser Valley, and how communities and different sectors, including health, the community sector, emergency management, municipal, and others were able to come together, and the lessons that were learned as they were addressing these emergencies, but also post-emergency as well. Before we begin the webinar, I'd like to start off with a land acknowledgement. So United Way BC acknowledges the homelands of the Indigenous peoples of this place we now call Canada, and honor the many territorial keepers of the lands on which we work. Today I'm working from our Burnaby office. So this is located on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam peoples. And I was reflecting for the land acknowledgement about this topic and how it relates to Indigenous communities across Canada. And I came across a really interesting resource, which is the Canada Climate Atlas, which my colleague Wingsy can put a link to in the chat. And this resource actually combines mapping, climate data, and Indigenous storytelling together. And it provides a really interesting map where you can look at different Indigenous communities across Canada and also see the climate trends that are occurring in them, and also hear different perspectives and watch videos in regards to Indigenous perspectives on climate change and how they're being affected by it. So this was a really interesting resource, and I would encourage you to take a look at it when you have time and to learn more about the changes that are occurring in terms of climate and how they're affecting different communities. I'd like to make a few housekeeping notes for the webinar. So during the webinar, all the audience will be muted, but feel free to introduce yourself in the chat box if you like. So you can put in your name, your pronouns, I use she and her, your organization, the territories you're calling from, whatever you would like to share. If you'd like to use closed captioning, you can turn that on using the CC feature in the Zoom toolbar. During the webinar, there will be a question period at the end, but if you think of any questions during the presentations, please feel free to put them in the Q&A box at any time or in the chat. And the webinar is being recorded, and we'll be posting it on our Healthy Aging Core BC site, and the slides will also be made available. And if you've registered for the webinar, you'll receive a follow-up email, which will include the slides and the recording when they're ready. Now, for the agenda for our webinar today, we're going to start off with a presentation on the case studies that I mentioned, and this will be presented by Dr. Sharon Jamal and Leah Capella. And then we're going to have a panel discussion, bringing in people representing different sectors to reflect upon the research and the best practices that we'll be talking about. And the panel will include Shannon Parsons, Joel Van Huysen, and Aman Fazel. And then we'll have some time for some audience questions and reflections. And so without further ado then, I'd like to introduce our two presenters from Fraser Health. So Leah is a PhD candidate at SFU, a research trainee with Fraser Health's Long-Term Care and Assisted Living Research Unit, and a MyTech's Business Strategy intern. And Sharon is a research associate with the Long-Term Care and Assisted Living Unit at Fraser Health, and her research interests include applied health services and equity-oriented research with a focus on long-term care and assisted living. So I will turn over the Zoom to our presenters.
Thank you, Laura. I'm just going to get up our presentation here and very excited uh, to be here with you all. Can you hear me okay?
Yes, we can.
Great, thanks. So good afternoon, everyone. We're really excited to share the findings from our research planning project on intersectoral engagement in health emergency management for older adults with complex care needs in the community. The findings are hot off the presses, and we are exploring opportunities for knowledge mobilization and if it resonates. We would like to say a huge thank you to the communities of Chilliwack and New Westminster and to those who were key informants. If you
Sorry,
have feedback, oh, go ahead, Laura.
I was
Oh,
just going to
sorry.
say your slides aren't in presenter mode.
Thank you for that. You see, it's there we go. Thank you. Sorry about that.
Oh,
Um,
sorry, oh, now it's working. Perfect.
Good. All right. So I was just saying that I wanted to say a huge thank you to the communities of Chilliwack and New Westminster, um, and to those who were key informants. And if you have feedback or have anything more you would like to share, we're happy to hear from you. We're also very grateful to the Canadian Institutes of Health Research for the funding for this planning research project and wanted to note that this study itself is an intersectoral collaboration with our research team members from United Way BC, Simon Fraser University, and Fraser Health. So, why does this project on intersectoral engagement in health emergency management really matter for older adults with complex care needs residing in the community? Older adults with complex care needs in the community are disproportionately impacted by extreme weather events and public health emergencies, particularly when these events disrupt essential services and mobility. Many older adults rely on a combination of health and community-based supports, making them especially vulnerable when systems are strained or fragmented during emergencies. Effective health emergency management for this population therefore depends on coordinated intersectoral collaboration between health, community, municipality, the private sector, and more. However, promising practices for engaging these sectors collaboratively in an integrated and sustainable way remain underdeveloped. So, our project aimed to identify best practices for intersectoral engagement that enable an integrated approach to emergency management for older adults with complex care needs residing in the community. We undertook a case study of Chilliwack and New Westminster, and these two communities were selected because they were identified by our health emergency management and regional home and community care colleagues as engaging well during the events that occurred in 2021, such as the heat dome, atmospheric river, and flooding events. We conducted a total of 19 interviews with key informants across health and community sectors in Chilliwack and New Westminster. And the key informants from the health sector included managers and administrators of operations, specialized services, and programs, as well as frontline care providers, including home health home support, and community nurses, and others that were recommended by our health key informants. Community sector participants included representatives from municipal emergency management program, fire services personnel, leaders of community-based organizations, and others recommended by our community sector key informants. With that, I'm going to now invite Leah to share the findings from our study.
Thanks, Sharon. So we're going to start with Chilliwack, and Chilliwack's story really illustrates how long-standing relationships, regular community convening, and a shared focus on older adults created a strong foundation for intersectoral engagement before an emergency actually occurred. So Chilliwack's approach to engagement is really contextualized by its existing relationships within the Chilliwack Healthier Community Table. So the Chilliwack Healthier Communities is a network of over 45 stakeholders across nonprofit, private, volunteer, and government sectors, as well as Fraser Health. And it includes focused task teams addressing community identified priorities, one of which is older adults through the Healthy Aging Task Team. So older adults as a population were already identified as a shared priority. In addition, a foundation of trust emerged through consistent engagement. So the Healthy Aging Task Team brought together municipal leaders, Fraser Health, senior serving organizations, nonprofits, as well as other community partners through regular meetings. And for Chilliwack, leadership was also deeply relational rather than positional. So while the city funded a coordinator to keep momentum going, collaboration was really sustained more through presence and consistency than through more formal authority structures. Momentum was also built through longstanding effort rather than crisis urgency itself. So the relationships already existed before the heat dome and before the atmospheric river actually occurred. So this meant that organizations didn't have to establish collaboration in the middle of a crisis. And key informants from Chilliwack told us that organizations became familiar with one another's roles, their capacities, as well as their limitations through these years of regular convening, meeting for workshops, writing newsletters. So a familiarity was really enforced through this standing monthly meeting structure. We also heard that partners collaborated beyond emergencies themselves. So the task team was not created for emergency management. It actually focused broadly on healthy aging and community well-being, which strengthened collaboration for when emergencies later occurred, but also allowed for partners to continue engagement outside of emergency contexts. And a really notable part of Chilliwack's story is this kind of real-time readiness that emerged through their regular rhythm. So during the flooding, Fraser Health home care workers suddenly couldn't access fuel because supply routes were disrupted. And because relationships already existed, Fraser Health and Chilliwack's emergency program quickly coordinated access to municipal fuel pumps so that home care workers could continue reaching older adults. Another part of Chilliwack's story that stood out was their informal familiarity that enabled learning and adaptation and quick problem solving. So these existing relationships with the municipal emergency program actually enabled Fraser Health, for example, to coordinate access to the Chilliwack airport so that dialysis patients could still reach treatment despite the obvious transportation disruptions. Information sharing also flowed more easily across sectors, including around initiatives like SFU's DIY air cleaner project. And so Chilliwack relied heavily on this mutual understanding rather than formalized agreements. So trusted actors such as community connectors, pharmacies, liquor stores, social prescribing, and community organizations became important touch points because they had everyday access to older adults who may not have been connected to formal systems. So rather than relying on more formal MOUs, collaboration was really sustained through familiarity, trust, and these ongoing relationships that were built over the years of their shared work. So in many ways, Chilliwack shows a model where preparedness was deeply relational, and the ability to respond during crisis came from long-standing effort, their regular convening and collaboration that extended well beyond the actual emergencies themselves. Next slide, please, Sharon. Thanks. So, New Westminster's story demonstrates something different. It demonstrates how the trauma and system gaps exposed during the 2021 heat dome became a catalyst for rapid collaboration, innovation, and long-term intersectoral change. So, during the 2021 heat dome, many older adults were isolated in overheated apartments, unable to safely leave their homes due to mobility limitations, transportation barriers, as well as social isolation. And community-based organizations became really critical in identifying hidden populations. So they knew who their population was, and they were able to create daily call lists, distribute cooling supplies, as well as help transport older adults to cooling centers using shuttle buses. And New West's intersectoral trust was really forged in the heat of the crisis itself. So fire and ambulance services became incredibly overwhelmed. Fraser Health staff encountered deeply distressing situations, and organizations across sectors experienced this event as very traumatic. And New West key informants that we spoke with consistently mentioned this shared trauma leading to this realization that no single organization could or should manage future emergencies alone. And what this led to is some really strong champions for change that emerged across sectors. So, Municipal Emergency Management Program, Fraser Health, fire services, city leadership, and community organizations began working together in new ways and openly acknowledging system gaps as well as committing to actually doing things differently. So, the experience of the crisis was intentionally leveraged to create change. And rather than simply improving existing systems, they began asking how they could ensure that this level of harm and trauma would never again happen to older adults or to emergency responders. And this motivation really catalyzed the intentional creation of what is known as the Emergency Monitoring Center as this shared intersectoral emergency response model. So with this, initially reactive meetings evolved into sustained collaboration. And what began as more post-crisis debriefs gradually developed into ongoing intersectoral planning, relationship building, as well as operational coordination. And when we spoke with informants, we learned that it was really the trauma that created this shared, never again motivation. And informants repeatedly referenced this emotional impact of the heat dome, particularly the distress experienced by fire services and Fraser Health staff in responding to this overwhelming need with very limited options. So after this, emergency management really shifted toward this broader co-ownership across sectors. So responsibility for supporting older adults expanded beyond fire and emergency medical services to actually include Fraser Health, Municipal Emergency Management Program, city leadership, as well as community organizations as more active partners. And in doing so, the system silos actually became the catalyst for this co-designed innovation. And one of the clearest examples of this was the development of the Emergency Monitoring Center at Century House. And Century House is an existing senior center. So the city identified that site. Fraser Health worked through clinical assessment and staffing requirements, and fire services actually helped shape the patient flow and all of the transport processes. And partners conducted joint site visits and collaboratively planned all of the operational details, ranging from everything from Wi-Fi access to actually making sure they had access to private clinical spaces. And following this, memorandums of understanding or MOUs and more formal agreements really helped to formalize that collaboration. So the city and Fraser Health actually established agreements with local taxi companies to safely transport the older adult home from the emergency monitoring center, while things like mock drills, operational walkthroughs, annual preparedness exercises really became embedded into this ongoing planning. And it was collaboration, again, that ultimately became a mechanism for innovation. So the Emergency Monitoring Center created this new shared model where fire services could assess older adults in the community and then divert non-acute patients away from the overwhelmed emergency departments to receive their cooling and monitoring from Fraser Health nurses and care aides instead. And this really helped reduce pressure on hospitals and emergency management services while still ensuring that older adults received safe and appropriate care. So while Chilliwack shows how longstanding relationships can support emergency readiness, New West shows how the crisis itself can really catalyze trust, innovation, and long-term systems change. And what's really inspiring about this work is that while New West and Chilliwack started in two different places, one already had some existing relationships, the other had to more so react in the moment, they both still came out with promising practices for how to engage intersectorally. Next slide, please, Sharon. So we saw that these practices could be mapped across the initiating, continuing, and sustaining phases of engagement. And when we think about initiating engagement, identifying your population and who supports them is very critical because clarity about who you're supporting helps to clarify who should actually be engaged. We also saw the importance of partnering with unconventional and trusted actors. So this meant asking who has informal access to older adults or isolated populations and making sure to actually include them. We also saw that building relationships early before the crisis was important because trust takes time and it's hard to build that when you're in the middle of an emergency. We also found that it was important to commit to leadership, not just titles, because the most effective leaders are those who are present, those who are consistent, and they're trusted. Another key practice was to make the most of post-crisis momentum because the window after a crisis is very powerful for actually initiating engagement. Another promising practice in the continuing phase was creating consistent and inclusive convening spaces and a collaborative culture because these regular meetings were what was building trust, understanding, and readiness. Fostering a shared purpose across sectors was another promising practice where a shared motivation, for example, supporting older adults in this case, really worked to align diverse players and create those shared values. We also saw the importance of establishing a culture of readiness, not just response. So where health emergency management needs to be part of daily operations, not just during crisis mode. We also found it important within the sustaining phase to support ongoing learning across perspectives. So meaning actually bringing organizations together to reflect and learn from their different experiences. It was also key to formalize agreements to support clarity during crisis. So clear agreements such as MOUs or templates actually worked to really reduce confusion when under pressure. And finally, we saw the importance of being able to innovate across systems and technology barriers because these digital divides, privacy laws, and really incompatible systems require those creative solutions. Next slide, please. So a key takeaway from this work is that effective intersectoral engagement in health emergency management is less about adopting a single fixed model and more about having a dynamic and really relational view of engagement. So embedding a shared set of values and practices across the different phases of engagement. Importantly, These practices emerge directly from the lived experiences of our participants, reflecting on real emergency events. And therefore, this is real world insight into how engagement actually happens in practice. And although these two communities really differed in their context, their timing, their approach, the same practices consistently emerged across both cases. So this suggests that these practices are adaptable and they are transferable. Communities can kind of use these regardless of their starting point or the type of health emergency. And so this means that communities could start wherever they are at any point in the process and just keep building toward more coordinated and integrated engagement over time. Most importantly, this work reinforces that intersectoral engagement is dynamic and it's a relational process, and it must be intentionally initiated, continued, and sustained over time. And for adult or older adults with complex care needs and living in the community, this kind of sustained and very coordinated effort is essential. So I'll pass this back to Sharon.
Thanks, Leah. So, with that bit of sharing of our findings, we're now going to transition to our panel. And we'd like to introduce our panelists. So, Shannon Parsons is a clinical resource nurse, regional home and community care at Fraser Health, and she supports emergency management for home and community care. Joel Van Huizen is a health emergency management specialist, regional home and community care, also at Fraser Health, and health emergency management, Lower Mainland, BC. He supports emergency management and disaster preparedness for home and community care, as well as long-term care and assisted living. Aman Fazal is a coordinator, emergency response and partnership development, community impact and investment with United Way BC, and supports the overall emergency response at United Way BC. So our panel in turn will reflect from their perspectives on how this resonates with their experiences and will share their reflections on promising practices, which we will pull up on the screen in a moment. Also, to let you know that we actually did provide two questions to the panel to ponder on and to share their thoughts. So, how do the findings resonate with your experiences? And what are your reflections on the promising practices? Following the panel, we will open it up to the audience to get into the conversation with us and would encourage you to put your questions, reflections into the chat. My colleague Janice Sorensen will be monitoring the chat and the Q&A box and will help to moderate as we move into the audience portion of this. So with that, I will move to the next slide where we are showing the promising practices again and invite Shannon to start your reflections for us. Thanks.
Thank you, Sharon and Leah, for including me in this meaningful conversation. Yes, after reflecting on these promising practices within home and community care, I myself have several takeaways. One is the importance of identifying our population and who supports them. I think by identifying our most vulnerable population and intentional mapping of their formal and informal supports, we are better able to support a more coordinated approach to care planning and reduce that duplication or gaps. I think it also allows us for more meaningful engagement with our partners. And by understanding that target population and their support system, this allows us to be better prepared and able to support our clients in the event of an emergency. So I think effective care isn't just about the client, it's about strengthening that ecosystem around them. And I think for myself as a clinical resource nurse, I can help to bridge those gaps. Another takeaway that I have is the building of relationships early before the crisis happens. In regular regional practice, I've seen how crises often expose the strengths and the weaknesses of existing relationships. And trying to establish trust during a crisis is often reactive and less effective. So that proactive relationship building with our site leaders, our frontline staff, and our community partners during those non-crisis periods, like regular maybe check-ins or joint problem solving and visible support, can really build that credibility and familiarity. And I think as a CRN, I have that opportunity to be consistent and an approachable presence, which makes it really easier for the teams to reach out early when concerns arise, rather than waiting for situations to escalate. So I really see that trust is a form of clinical infrastructure. I also see the importance of leadership and that coaching, mentoring, advocating. It really is key when supporting teams through change and uncertainty, and recognizing that our frontline staff are key individuals to support improvements and the culture of that change. I think lastly, a takeaway is that need to make the most of like a post-crisis momentum. I know in the post-crisis periods, there's a unique window of time for reflection and change, and there's often heightened openness to new approaches and willingness to engage differently. So in my experience, this has been a key time to facilitate structured debriefs, capture lessons learned from frontline teams, introduce practice improvements or education initiatives, and strengthen partnerships that were activated during the crisis periods. I think this period after a crisis is not just about recovery, it really is an opportunity for transformation. So I think finally, reflecting these promising practices align real closely with the realities of complex community-based care. They emphasize that high quality of outcomes that are not driven solely by clinical expertise, but by that relationship, trust, and timely action. And by embedding these approaches into our daily work, I think we can contribute to more resilient teams and better experiences, not only for our clients, but their families and our clinicians. Thank you.
Thanks, Shannon. That was great. So, Joel, can we flip to you now?
Yeah, absolutely. Um, I'm going to just paste into the chat a quote and I'm putting it in there because I'm not a clinician. I focus on emergency management primarily, but the quote reads, where unfamiliar or uncomfortable officials meet in unfamiliar settings to play unaccustomed roles, making unpopular decisions based on inadequate information and in too little time. And that is referencing emergency operations coordination. And when I'm looking at these promising practices and I'm thinking back about the work that we've done, I think how can we start to make change some of those things? How can we make people less uncomfortable? How can we start to understand the surroundings that we're dealing with? And how can we familiarize people in these roles? And and so these promising practices, like if we can start to identify who we are going to be supporting, who the vulnerable people are, where the gaps might be proactively, then maybe even if we're still uncomfortable in our roles, we know who we're supposed to be sorting, right? And a lot of the unfortunate results of the events that occurred in 2021 and then in 2023 with the wildfire seasons, it was we were shocked at who is impacted. We maybe assumed a place was going to be more immune from the impacts of severe weather, or we weren't anticipating the amount of frail people who were living alone and were at risk of extreme heat. So by understanding and identifying the population, right, we can respond quicker. And a consistent theme in my work supporting home and community care and our home support and home health teams in Fraser Health is how much of that work has already been done at the local level. And taking that knowledge and the understanding and the community awareness and work that's being done and making sure that the rest of the region understands that, it shifts the conversation from how do we fix the gap to how do we support the people who are already fixing the gap. So we, time and again, when Shannon and I are working together and we're identifying how do we prepare for this coming season? What do we need to do? Often the conversation has shifted away from, well, we got to identify the gap to, well, let's just find out what the gap is from the people who are doing the work, and instead say, what do you guys need from us? And that has allowed our work, I think, to be more efficient and to be more targeted and to be more of a grassroots approach and moving away from a typical bureaucratic method of a top-down, let's set some new regulations in place and let's have some administrators dictate what will be done and ignoring the best practice of the clinicians who know the people that they're supporting. So I find that that theme runs all throughout these promising practices. You can't do that approach without relationship building. I was very grateful when I started my role because I'm not a clinician to work with Shannon, who's worked at the local level. We can then go and reach out and talk to the leadership who are in each of the communities, and they'll start pointing us to people. Oh, talk to this organization, talk to that organization, and and then I think for me that's the leadership. That's how we lead without any specific title. That's just how we take emergency preparedness for home and community care and Fraser Health, and we lead that. And we lead it by asking questions and by being curious. And and in order to do that, right? And then so that's the initiating component you see on your screen right now. The continuing component of that is what does readiness look like for me? I often think, how do we move from people saying, I've got tools to I know how to use the tools, right? A great example is people who say, well, I've got a generator in case of a power outage, but maybe I've never even turned it on. Maybe it's brand new in the box and I don't know that I needed to prime it first, or it needs a warm-up period, or I don't have fuel for it, or I don't know how to plug things into it or whatever, right? So taking that next step forward for me as an emergency manager and starting the conversation, like the what if conversation. Well, what if this happens? What will you do? And then we can start to actually make sure that like where there's a gap from the health side, because we look at the municipalities and they're very well practiced. The city of Chilliwack and the city of New Westminster, they know how to take care of their infrastructure. And and often the gap, the area that has had the least amount of input and investment is the health response. So then we can just say, okay, well, we don't have to worry about the city of Chilliwack because we've talked with them and they are connecting with their communities and they're doing a tabletop exercise or they're putting out communications. Well, why don't we measure that? Why don't we put out some communications? And for I think for me that has been just the pleasure of seeing that happen and being able to work with incredibly competent staff who care very passionately um, about the people that they support. And all we have to do is say, well, what do you need? How can I make your work easier? Here, what is the gaps that you're seeing? And then we can go back with a targeted resource request. And it's much more likely to get approved because we can say, well, we don't actually need, an unending, unlimited amount of resources. We just need someone to so we need access to an administrative staff member who can put out KYIs or like information on extreme heat. That's the biggest ask that will make the biggest difference. So that's my observations on this, Sharon.
That's great, Joel. Thanks so much. I'm going to now ask Aman to share his reflections.
Great. Thank you very much, Sharon, for passing the floor and also for this opportunity to participate and to share. Thanks also to the entire team for your leadership in this work. It's an especially important discussion right now as we approach the 5-year mark of BC's tragic heat dome, as well as the 2021 atmospheric river, in addition to all the events that have happened over these last few years, specifically in British Columbia. Firstly, just a couple of things as it relates to our own experiences and the findings and the key takeaways. At United Way BC, our emergency response, recovery, and resilience framework is built on a foundation of partnerships and relationships. And these relationships are ones that members of our team across the organization foster year-round. And so what that means, as I think you'll hear me say multiple times over these next few minutes, is that our emergency response work is year-round. It's not only when crisis hits. And so this might take the form of one-on-one relationships with organizations or municipalities or health authorities. Notably, much of our regional work across the province includes bringing together what we call a social response task force, which brings together a group of representatives across various sectors who commit to coming together during an activation or during a particular response. I wanted to speak to that a little bit. Again, as it relates to a takeaway of mine through what was shared. To expand a little bit more, a social response task force brings together including members of emergency management and climate readiness, emergency support services for a specific municipality, First Nations Emergency Services Society or FINESS, BC Housing, Red Cross, local community organizations, faith-based organizations, etc. The list goes on. Later on, I'll share a link to a guide that's on our website on forming a social response task force, and you'll see there's examples of close to 20 types of organizations that could be represented in a social response task force. And again, this speaks to the intersectoral engagement that we've covered today and the ongoing relationship and how important it is throughout the year. These task forces that we support have ongoing meetings, sometimes monthly, sometimes quarterly. And the nature of those meetings is really about preparing to build process and to form the relationships ahead of when emergency hits, so that everybody knows what support can be provided, and that response or that activation is more congruent, is more everybody's working kind of off the same playbook. It's cohesive, if you will. And so, of course, this is adaptable. And so the reason I wanted to share this particular idea today is because it is adaptable not only to various types of emergencies, but various types of scale and organizations. This is one example of multiple sectors coming together, but you could use it in one organization to bring various departments together to focus on how you as an organization are going to respond. Or you can champion something like this in your own communities that you're in. For those who are interested in learning more or adapting this model, again, I'll share a link shortly, which would take you to our website where this guide lives. As it relates to the promising practices that we see on the screen, as I've said, the work is year-round for us at United Way BC, specifically this idea of relationship building, which we've heard emphasized several times over the last 45 minutes or so. And so as you can appreciate, naturally, building a relationship or forming new relationships to better understand what supports can be provided while you're in the middle of an emergency is challenging because everybody, of course, is so busy responding. And that's why those relationships ahead of time are so important. The partners allow us at United Way BC to ensure that the impacted individuals in a particular crisis are getting the supports that they need when they need. And it's not just about responding when an emergency or when crisis strikes. It allows you to deliver workshops or resources or other tools that support with preparedness. So one example I'll share is thanks to funding that we received from the Ministry of Health, as well as emergency management and climate readiness, along with partnerships that we have with 4 or 5 different organizations. United Way BC a couple of years ago published 2 emergency preparedness guidebooks, one of which is specifically tailored to supporting older adults and supporting older adults preparing for an emergency. These guidebooks, again, are specified for those living conditions, and support in things like building an emergency kit, having an emergency plan, listing your emergency contacts, and a variety of other resources, again, to make sure that there's preparedness in the communities. The link that I'll share includes those guidebooks as well for you to view. And so I wanted to speak a little bit about this notion that's on the screen here around making the most of post-crisis momentum. Because post-crisis is really where United Way BC is unique and what makes our approach so different from other response organizations. You've heard me say a couple of times now, as I promised you I would, that our work is year-round. And so at United Way BC, we are in community year-round, building those relationships. We're there when crisis hits, and we're there long after when those immediate response organizations leave the community, and we're there to support the community's rebuilding and the community coming back together. So our work looks like supporting initiatives and projects that remain in community, sometimes for multiple years after a crisis. And so this is really where we see community organizations step up to support their communities and their residents in recovering and ultimately building capacity within the community, which then builds resilience, so that if a crisis hits, again, if we go into another heat spell or whatever the crisis looks like, that community is better prepared, which again speaks to what we see on the screen around establishing this culture of readiness, as well as ongoing in a way that's sustainable and ongoing. Those are, again, just a few reflections. I know we're limited by time and we want to keep some space for Q&A. So I'll pause there and pass it back to Sharon and Leah.
Great. Thanks so much, Aman, and thank you to our panelists. We're going to now move to the audience and look forward to your thoughts and any questions you have. And my colleague Janice will be helping to moderate that. And happy to leave the promising practices up here on the slide. So if you have reflections, you can have a look at those.
Thanks for that, Sharon. And I really encourage anyone that's been listening to this presentation and panel discussion, I encourage you to please write any questions or comments in the chat in regards to the panel discussion and these promising practices. And I don't think we have any up yet, but maybe just to kick things off, Sharon and Leah, thank you very much for your presentation. And there's been a focus within your research on the promising practices and identified in the table here. What did you come across in terms of maybe challenges and barriers that some of the cases communities were experiencing within their intersectoral engagement, and some comments there?
Thanks for that question, Janice. Yes, we heard lots of great things, and the promising practices emerged from a lot of the analysis after our conversations with our key informants. They also talked about some challenges. And, one of the challenges that they talked about was around competing priorities. So, competing priorities within organizations and, really made it hard to engage or to commit to collaborative meetings. So, how busy people were. Another thing that came up was organizational capacity for time away engaging and collaborating. So often, uh, uh, organizations found it really difficult to find that time to go to regular meetings and to do that. Another challenge that people talked about was sort of the staff turnover that sometimes can happen in organizations. And so then how do you, with that staff turnover, maintain relationships and that engagement if it's really individually relationship based rather than maybe a bit more formalized. Um, and one of the other challenges that sort of came up was around lack of funding to support intersectoral collaboration. So often, organizations were, in the doing mode, and there was really not so much funding to support the time to be able to have staff go to meetings and things of that nature. So I'll stop there for now. Yeah.
Thanks for that, Sharon. And I can see, just aligned with what you were sharing there, we've just had I guess, a comment from Mary Catherine Williams. Thanks for that. It's just mentioning, thanks for the informative presentation. Not a question, but a comment about how challenging it can be to bring and keep very busy people, orgs from across sectors engaged. I see Joel has a hands up, and I'm also wondering if maybe with what we're discussing about, since it sounds like it's resonating, if there's any further comments or maybe even tips of how we kind of overcome that. So please go ahead, Joel.
Thank you. And I think like what I see like the challenge is reflected in the relationship building thing because I'm busy, Shannon is busy, we're all busy, and to find the time finding the resources to commit to a participation in something is one thing, but even just finding that time. And so I have found a lot of value in just introducing myself and letting people know that there's health emergency management resources available. And often we find in a crisis is people are they tend to feel alone and they tend to feel like their themselves or their immediate workplace or their community is isolated in this event. And so if we can try to move past that by saying, well, reach out and let's talk and see, because maybe there's similar challenges and maybe we've stood up, like, in healthcare, maybe we've stood up a regional response, maybe we're activating resources across the region. And in our healthcare setting, we try to have a no wrong door approach. So definitely during the flooding, and during the heat dome, we were encountering people who were desperate for support. They'd never encountered such extreme circumstances, and their supply lines were disrupted, or their staffing was disrupted, or they were concerned about incredible amounts of illness. And so we had to start to activate things really quickly. And looking back, if we had built those relationships sooner and people had felt comfortable to reach out sooner, like we want to broadcast, stand on the mountain and scream, reach out. We are here. We want, and we can do that in a one-off, like we can do it in events like this, but also if we can start to get those tables in place and get that conversation going, I think like that is an incredible challenge. If you're the lead staff, or if you're the responsible party, and you've got people in your facility who are all of a sudden experiencing negative health impacts from extreme weather, and you don't know what to do, we want to change that to be like, well, there's several people you could call. Reach out to your municipality, reach out to the hospital. If you know someone in home health, reach out to them, and we'll start to address this. And we'll start to send resources, and then we'll figure out who's responsible. And that was the key thing, especially in 2021. Let's get the resources moving, and then we'll figure out how it's going to be managed in certain instances, because it was so critical. And I could go on about all the crazy relationships we built on the fly. And if we can formalize those or make them ongoing, it will be so much smoother and so much quicker to deliver support into the
Goodness.
communities that are impacted.
Thanks for that, Joel. I see we've got Aman and Shannon putting hands up there to maybe weigh in on this topic as well. I just wanted to add, Mary also added, we're finding that having champions to get and keep things going is helpful. A person or one of the orgs, we're a smaller community, so not as many resources available. So I'm going to hand off to Aman and then Shannon, and then we also have another question that's come up. So if you want to add to what's being discussed here, thanks for that, Joel.
Thanks, Janice. I'll very quickly add just a couple of thoughts. One, on one of Joel's initial points there around just the importance of partnership building and ahead of time. And I think one of the things for us, at least from a community organization lens, it can sometimes be a little bit confusing for people or organizations to know exactly what and how United Way BC can respond. And so part of the benefit of building those relationships ahead of time is, just as important as it is to share how we can support, it's equally important, we feel, to share just what we're not. We're not going to necessarily replace the Red Crosses and the HEMBCs of the world, but we provide an additional layer of support in a very specific way. So that's one way that building relationships for us has helped is for organizations to understand how and when they can turn to us. The other thing just around capacity, as it relates to the social response task force that I shared about earlier, absolutely, time and time is a scarce resource. And so what we have found at least helps is, number one, for there to be kind of a clear understanding of roles and, what the expectation is for those who sit on these roundtables, if you will, or on this task force. And monthly meetings is not necessarily required, but even just bringing together everybody quarterly, and having those discussions so that you are as prepared as possible. I think this notion that you suggested or that you brought forward around community or like champions is also extremely important, and to leverage the individuals who are passionate and want to contribute in a way, and having them as part of those conversations in a lot of ways. When you form relationships and task forces like this, if there's nothing to do, that's actually a good thing. It means there hasn't been an emergency, but it's hard for people to then prioritize the work, of course, because there are other pressing matters. So totally appreciate what you're saying, and we have found some success in just clear expectations and um, you know to use the old adage, not having meetings for the sake of having meetings, and then coming together to have dry runs or practice exercises so that everybody knows exactly what to do when it's time to activate.
Thanks for that. And then Shannon, maybe just short, because we've got a couple minutes, and then we'll get on to the next question. So thanks for that, Amon.
Okay, yes, I just wanted to quickly highlight that some key pieces that have been super effective in Fraser Health is really that socialization of emergency management, right? That resources that are available in the preparation, practice runs, because in the last 4 years, the difference between a heat alert is coming now compared to 4 years ago is everyone is on the page. They're already checking their most vulnerable clients and making sure they have the resources or the cooling kits. I think also just doing those check-ins either during an event or an anticipated event, right? Because then people, like Joel said, maybe don't feel as alone. They know that there's someone that could support, maybe talk through a scenario with them. I think the other piece is the connection and sharing of our resources between healthcare and our community organizations. And that has been really successful for us over the past year. For example, if there's cooling centers and I know about it, I can reach out to the community connectors that are attached to the community organizations, and vice versa. If they are hearing about things, they reach into me so that we're all hearing what's out there to support our clients because knowledge is power.
Thanks for that, Sharon. And just we've got the last couple minutes. There's some more questions here. So one's asking, how can each community identify priority populations and also ensure that their information is safely stored and accessible during emergencies, particularly for clients not connected to home health or without a family doctor? So if anyone has maybe some advice on that question, also to refer to, there's some chat going on about some events and activities coming up. So just to draw folks' attention to some of those events being shared. So anyone that has any advice on that with identifying priority populations and ensuring that information is safely stored and accessible in emergencies.
I can maybe just start off, but it probably doesn't speak to the question as well because I'm speaking to those that are known to home health. We do have vulnerable sort of criteria that we look. We've developed a seasonal preparedness dashboard. Obviously, our information is contained within an EMR, a platform that's safe and secure. I do connect with community connectors. They know to reach in if they have clients that are of concern. But I do know this has come up for those clients that are not known to home health, that where how can we support them, right? Because that sharing of information gets difficult. I don't know
Sure.
if someone else has something.
Great. And anyone else with comments to that or some points to answer that question? Otherwise, thank you very much, Shannon, because I'm seeing we're like at the hour. Time flies when you're having fun. So were you gonna, yeah, yeah, you were gonna go, Laura, to
Yeah,
thank you so
sure.
much, United Way BC.
Yeah, so we are at our time now. So if there's any kind of like last thoughts anybody would like to get in response to any of the questions, maybe we can do that and then we can start closing.
I just wanted to take a moment to say thank you to our audience and to United Way BC for hosting this. And really, just to say that in closing, some things to leave you with. Relationships are foundational and also dynamic. So engagement must be intentional and is an iterative process. So it really requires intentionality to do that, to start, to keep going, and is difficult in some cases, as we've heard. But thank you very much for your interest and joining the webinar today. We really appreciate it.
Yeah, thank you very much, everyone. Thank you to our wonderful presenters for that really great session and also the engaging conversation from the panelists and the presenters in response to the questions. We'd also, of course, like to thank our partners from the communities who were participating in the research. Shout out to them. And I saw a few of them in the chat attending the webinar. So that's great to see you all. As I mentioned, we will be sharing out the recording and then also the PowerPoint slides as well to everyone who registered. I'm also going to suggest, I think we got to most of the questions, but perhaps if it's okay with the presenters, I could share out your emails. And then if anybody had any follow-up questions that they weren't able to ask, then they could just follow up directly and ask those, if that's okay with everyone.
That'd be great.
All right, great. And so in that case, we will be ending the webinar, but I did just want to note there's a brief evaluation survey that'll pop up. Just, I think it's 3 quick questions when you exit the webinar. So if you can take the time to fill that out, that would be appreciated. And that's all. So then I just hope everyone has a wonderful weekend and thank you very much for joining us. Take care.
Thank you. Bye-bye.